Alison Hayes has been living with FND for about 20 years. She has spent much of that time learning to manage her symptoms and setting goals that give her a sense of purpose. And we're excited to have her with us here today to give us some of that perspective that she has and what she has learned. Go to Alison.
Hello, everybody. Hi. Sound okay?
Yep, we can hear you. Go ahead.
All right. So I have a blog called Thriving While Disabled, which I started about two years ago. It's built all around the concept of living your best possible life while managing a disability. As mentioned, I have FND. I was diagnosed in 2003 after my symptoms became really severe back in the winter between 1999 and 2000. So I've had it for quite a while. And for me, I went through multiple neurologists before I found somebody who actually was able to give me a diagnosis. I spent about 3 years seeing various doctors. I went through, I think, 3 or 4 different neurologists until I was finally referred over to Columbia Presbyterian's Hospital and their Center for Movement Disorders. And there I was given a firm diagnosis of conversion disorder, which was the term it used at that time. The neurologist there who diagnosed me, I actually stuck with him for 11 years and would have continued to see him if he hadn't ended up moving across the country. And to give you a little more of my story, I have movement symptoms primarily. It can be any part of my body, anytime, yay, functional symptoms. On top of that, I also had a lot of bladder symptoms, and I've developed a lot of sensory symptoms since then. I have been living with and managing this for quite some time. I did have at least one period where I had no symptoms, but that was actually prior to getting diagnosed. Since I've been diagnosed, I've had symptoms most of the time, but the degree and severity of them has been dramatically different. And so I spent a lot of years learning how to live with this. And then also I discovered that I couldn't be happy unless I had some other purpose, some other goal, something else I was working towards. So that would be, at one point it was studying and changing careers. One point it was working in geographic information systems. Later I actually went to graduate school, and that took a while, but I did end up actually graduating with a master's in organizational change management. While I was in graduate school, my partner was injured in a car accident and suffered a traumatic brain injury. And so I had to emotionally and medically support him through all of his treatment process. And then I actually, shortly after graduation, through FND Hope, discovered the MORE program and went there and went through their entire treatment program, which dramatically improved my symptoms. It gave me a lot more control. However, about 7 months after that, my partner was slipped and fell and shattered his acetabellum, which is, the biggest bone in your body and major joint. And it took us a year of me managing all of his medical care to determine the cause. He actually broke the bone because he had a condition called pernicious anemia, which is extremely common, but like the osteoporosis that caused his break, not common in men under 40. So I had a lot of medical mysteries to solve. Today, what I really want to speak to you about is finding the right doctor for you, because I've learned through experience that there are so many unfortunate experiences you can have with doctors, and I know that especially early in the diagnosis process and shortly after becoming ill, it's really, really challenging to know what to do and who to see and how to handle it. So the first and most important thing I want to tell you about that is doctors are people too. And it doesn't do you any good to put them on a pedestal of any sort. And I know a lot of people end up falling into that. Doctors, the idea that the doctor is always right and they know what to do. As you heard from Dr. Perez, doctors can do amazing things, and there's a lot that's really important for you to learn. But there's also doctors who don't get it. There's doctors who have a hard time really empathizing with their patients. And so the key thing for us as F&Ders is to find doctors who will understand and work with us. And that one of those things is, if the doctor isn't helping you, if the doctor isn't understanding you, you have the right and the responsibility to yourself to fire that doctor. It's really important to be able to get the support you need. And sometimes doctors aren't helpful. Some individual doctors don't understand or aren't helpful. So finding a replacement if that happens is very important. You also really want to work with them and have them be part of your team. You don't want a doctor who dictates what you do. Dr. Perez was alluding to this. It's really important for the patients and the doctors to communicate well together, to have a good, deep, detailed understanding of what's going on. And in the case of FND, like Dr. Perez was mentioning, we really want to have a positive confirmatory diagnosis, not a diagnosis by exclusion. Diagnosis by exclusion are very common. It's when the doctor runs out of other options. They test for everything they can think of, and then if they don't have any other ideas, it's whatever's left in their, it's whatever idea is left for them. And that's not how we want to be diagnosed. It's really important to have a doctor who is FND aware or willing to learn. To get that initial diagnosis, it's really important that they're able to positively confirm, which is better done with a neurologist who knows a fair amount about FND or has been exposed to it and treated patients with it. If they're not, many other types of doctors though aren't going to be, and that's okay, but you really want it to be a doctor who's willing and able to really explore your symptoms and their causes with you. What I mean by that is, with FND, we can have all different kinds of symptoms. Any symptom could be FND and could be something else. We want to have a doctor who will help us rule out any other cause that could bring out our symptoms. Sometimes we have multiple conditions, that's fine. But having a doctor who, when you come in with a new symptom, doesn't dismiss it as FND automatically, or who listens to you when you say, either this feels different or I'm pretty sure this is FND. And then you run through what the other alternatives might be and think it out and make sure that make sure that you haven't left behind an option that might explain your symptoms, but also that you don't get stuck in a loop thinking about what you have and what that might be doing to you, because it is important to have peace of mind. Another really important key for finding a doctor who's helpful is making sure that they're actually reliably available. If it takes you a long time to get the appointment, for some specialists, that makes sense. But if it takes too long, you might need to look elsewhere just to make sure that you're getting the treatment you need. For specialists who are very experienced in FND, it might be a little different. I know I've had to wait as long as 9 months to see a neurologist who is experienced with FND. But once you are their patient, it's really important that you have somebody who's going to respond to you when you have a question or an emergency. I've really focused on that as a priority for myself. If my doctor, I have the neurologists that I've had historically have been very available. My first neurologist gave me his email address as soon, while I was his patient, so that if I had a new symptom or a new problem, I could reach out to him and get a response, usually within a day or two, about what my next step should be. Whether it was, oh, that sounds familiar, or do you need to come in, or things like that. My more recent neurologist, when I'd call into his office, he'd respond within a day or two so that when I had a new symptom, when I had a new problem, I could reach out right away and get that response. And I think that's a really important piece of being treated well and being
Thank you,
managed well.
Allison. I think too, some of the questions that we're looking at the Q&A coming in is with the difference in some of the countries and people that are in, you know, what are some tools that you found that maybe work with doctors? Because sometimes it's not always available to them to just change doctors, or, I mean, with trying to find a doctor that fits or does know about FND. Sometimes, like as you said, personalities might clash a little bit, but what are some tools that you found that helps you to work with a doctor that maybe is really busy, they've got a lot going on? Have you found other communication tools?
Well, I mean, again, each doctor has their own process. The doctor, like I said, I've had one with email and one with phone calls. If something's urgent, they should be able to respond to you. What I've found it's useful as far as getting into the doctor is to make sure I've got the right wording and the description of what's going on. When I call, I'll explain the symptom that's happening. I'll explain what's going on and why it's so important to see the doctor right away. As a non-FND example, my partner, like I said, turns out he has pernicious anemia. When I called the specialist, I was able to say, no, he's a very significant patient. In this moment, he is under 40 and has pernicious anemia, and we discovered it with a broken bone. Because he has osteoporosis, which also doesn't occur in somebody that young. So the idea with the communication with your doctor is once you've got somebody who's good, you hang on to them. And if after the first appointment, they're not helpful to you, it's time to see if you can find somebody who's a better fit. Now, working with somebody in the moment, it's about communicating clearly what your priorities are and making sure that they're hearing what's important to you so that you can, them hearing what's important to you so that you can make sure that they focus on the specific aspect of what's going on that needs to be managed first or that's top priority. The final thing I wanted to say that it's important to look for in a doctor is that they're trustworthy and you feel that you can rely on them. So, because basically if you can't tell them what you're experiencing, they can't help you. And I think that's hugely important. And what I mean by that is if you have any aspect of your identity that you're uncomfortable sharing with that particular doctor, it's time to look at what you need and think about what will help you the most. If that doctor can help you overcome your shyness or your fear so you can talk to them, or if you need to find a doctor who is more similar to you or who is more welcoming of you sharing your experiences. And the final piece I wanted to talk about.
That is great advice.
Yeah, it's finding the right doctor can be really tough, but when you find the right ones to work with, everything else becomes a lot easier and a lot more manageable.
Absolutely.
And the last bit I wanted to talk about was how to find your doctor. One of the big resources is FND Hope. They have now created a section of the website where you can search for practitioners that other people with FND have suggested. And so I actually recommend that as one of the first places that you go if you're not comfortable with who you're currently seeing or you're looking for somebody who's a better fit with you. Another great thing is, especially in the US, we have most insurance programs have online reviews of the doctors who they work with. So you can see what other patients have experienced. The big thing to be aware of with that is that most people who provide reviews, they have a very strong opinion. So most of those reviews are going to be either extremely positive or extremely negative. People tend to remember, record, and report their worst experiences and their best experiences. So what you want to do is take a look and see what people have said. Personally, I'll take a doctor who doesn't have entirely positive reviews if the negative reviews are related to wait times to see the doctor and other things that might be inconvenient but worth it, especially if the positive reviews are talking about the doctor spending time getting to know their patients better, things like that. One of my original neurologists, who's excellent, he would sometimes be an hour or more late to see me, but it was because he took his time with each of his patients to make sure he had their whole story and their full experience. So don't just look at, are the reviews positive or negative? Look at what's being said and why, so that you can find the things that are top priority. And another thing, if you're just generally looking for information, would be think about what the large research institutions, university hospitals, and things like that are in your area. Because like I said, one of the things that's most important for us as F&D patients is making sure that our diagnosis is correct and getting positive affirmative diagnoses rather than just that diagnosis of exclusion. So if the person you've been seeing suspects you have FND but isn't experienced enough to prove it, see if you can get in with somebody with a known reputation for being aware of FND, such as the doctors that FND Hope has mentioned, or doctors at another large institution that will have people with more experience in making those diagnoses, or doctors who have that FND experience. And using that, you can really bring a lot more out and learn a lot more than if you just, then you've got a better shot at getting better treatment.
Absolutely. Alison, would you mind telling us a little more about the MORE program that you've underwent and the benefits of that?
Oh, absolutely.
That'd be great. Thank you.
Sure, no problem. Yeah, so the MORE program, which is a movement reprogramming program, it was run in Fraser Rehab in Louisville, Kentucky, and I'm so glad I went. They have a really strong PT, OT, speech therapy if needed, all three of them, whichever one's most important, combined with, they've got a psychological staff as well. And so when I went in, I saw the psychologist daily, as well as, for me, it was PT, OT, and we did a little bit of speech work, but my vocal symptoms were pretty mild, so we couldn't even induce them while I was there. And the big focus of the program is all about reconnecting your mind and your body and learning to relax again and let your system integrate a little better so that you can actually regain that control over your body. So the psychologist was there to support me, but she also, every meeting was talking about different tools, including meditation and mindfulness and other psychological supports that could help me better manage my FND symptoms. And then the PT and OT programs were all helping me use those to better manage my symptoms. When I went into that program, I couldn't safely use stairs because my body stopped warning me when I get symptomatic. And so, yeah. So I went from stairs were no problem to I can't do that because if I try, I might have something collapse and fall down the stairs. And so then the fear of falling down the stairs after the first time my legs collapsed while I was climbing made it so I couldn't I couldn't even try. By the end of that program, I was walking very quickly up and down stairs without fear.
Fabulous.
Yeah, I limped in and walked out. And it was all about this like combination of using distraction techniques and doing like a focused control so that in both cases I could better integrate and manage my symptoms. And it helped me be able to, I guess the best way to put it is before I went to the program, I would try to do things despite my symptoms. So I would walk and then I would start limping and I'd just keep moving forward because I didn't know what else to do. After the program, I was able to get some control back. So I could, if I started having my legs shake or whatever started collapsing, I could actually stop, take a breath, calm myself down a little bit, take that little pause, and then walk forward without symptoms.
Which is so important, that little pause, like you just said.
Oh, it's essential.
Mm-hmm.
And so that was a lot of what I was working on with this. It was all about that symptom control and managing what was happening. I still have symptoms. Like I said, I went into a bit of a relapse after my partner was injured. And I've regained a lot of my control again. And I started my blog because I helped him through all of his medical stuff. And he was just like, oh, I don't understand how you did all that. That was amazing.
Yeah.
Why don't you share that with others? And
Absolutely.
so I've
And
built.
you have a great following also.
I'm working on it.
Yeah, no,
And
a lot of people enjoy your work.
I
It's
appreciate
very
that.
helpful. Very helpful. May I ask, when you just said you had a bit of a relapse, were you having to start from like the start again, or were you able to lean on what you had previously learnt at the Moore clinic to help yourself and gain more movement and so forth?
Well, it's both. Is the
Mm-hmm.
real answer. The tools from the Moore program definitely made it so that I was still okay. When I relapsed, I was still in better shape than I'd been before I'd gone to Moore. Let me put it that way. The other part was I immediately recognized that my symptoms were increased because of the trauma of my partner breaking his hip and me being at the hospital with him and trying to manage all that stress. So to me, that's a perfectly normal response for my body to the stress of him getting injured.
Yeah.
So I didn't look at it as a failure or anything on my part. It was a relapse based on a trauma that would have affected anybody. Does that make sense?
Absolutely. Absolutely. Anyone with FND, we don't fail. We try our hardest and we just keep going and going. So a credit to
Absolutely.
you. Yeah,
And,
absolutely.
and so what happened was, as he recovered and as the pressure on me reduced, my
Mm-hmm.
symptom control kept coming back up.
Yeah.
And so at this point, it's a little worse because I've had a migraine almost constantly for the last 6 months. So I've got a slight uptick in symptoms from where I was, 7, 8 months ago. But, I'm managing, I'm able to keep working on the blog, I'm able to work on things. I've actually developed an online course and am offering some coaching as well through my site. And so I'm moving myself forward and I'm developing the blog into more of a business while I'm making sure I'm sharing lots of information to everybody too.
Yeah.
And
Which is
that's all.
fantastic as well. And I love your energy in wanting to share your life experiences and lived FND experiences, which is so important. And we are finding more and more around the world. The more people share, the more we are alike. So we really are grateful that you're sharing that.
Absolutely.
I have a question here regarding your blog name. Okay, so we've got a question about your blog name, and also where did you say the more clinic you went to was? Someone just has asked that.
The Moore Clinic is in Louisville, Kentucky, and it was run by Dr. Catherine Lefevre. She's now moved on.
We love Dr. Catherine Lefevre.
Absolutely, I do too.
Yes, yes, we do.
And she has now moved on to, I believe, Northwestern, but I think the Moore program is still active. I'm not 100% on that.
Yes.
But so the Moore program is still active, and Dr. Lefevre would, like, she was the one who interviewed me before I was accepted into the treatment program, but she isn't super active during the week of treatment, because the way the program works is it's really nice because it's a hospital stay. So I flew to Kentucky and then stayed at the hospital from Sunday afternoon until Saturday late morning. So I didn't, and then treatment was all day with, 45 minutes here, take a little break, 45 minutes there, take a little break kind of thing.
Sure.
For the 5 days.
Yeah. I've actually just got a message through that clinic isn't active at the moment, but we will find out more about that. But I just did get a message through because I have lots of people talking to me in lots of directions. So we did just get that through. I apologise for those that I did say that was active, and you've all jumped online going, oh yes, that's active. Unfortunately, at the moment it isn't, though Dr. Catherine Lefevre is certainly still active within the FND and FMD caregiving and been a wonderful doctor that she is. Was there anything you'd like to tell us to wrap up our conversation today, and anything important that... Oh, I've just got another question in. Apologies. I was reading the question.
Somebody was asking about the name of the blog, I thought you said first?
Yes, that is correct. The name of the book, and that is the one that just popped up again.
Okay, so the name of the blog is Thriving While Disabled. And so it's www.thrivingwhiledisabled.com.
Right.
And I came up with the name because I think all of us, as we're learning to manage our conditions, are aiming towards thriving and living our best possible life.
Absolutely.
And so in my mind, the fact that you're working towards it means that in some ways you're already doing it.
Absolutely. On that note, we need to end our conference today, as we have gone over our time of 15 minutes, and I think everyone's enjoyed our speakers today. So thank you so much, Alison, for joining us. And